And it's been a week since the new guidelines on who should be taking cholesterol-lowering drugs came out, and patients and doctors are still debating what to make of them. That's because the new online risk calculator that tells us who should be using statins has fallen under fire after leading researchers from Harvard to say it overestimates how many people should take them. Scientists fear the controversy risks confusing patients. Dr. Mark Hlatky is the professor of cardiovascular medicine and health research and policy at the Stanford University School of Medicine, and he joins us via Skype from Palo Alto, California, where he's just returned from the annual meeting of the American Heart Association. Dr. Hlatky, thank you so much for your time. I do appreciate it.
Well, thank you.
Well, first of all, I'm just curious about what the conversations were like at the conference that you just returned from about these new guidelines and the new risk calculator.
I think people were surprised to hear that this controversy came up. You know, we hadn't really had a chance to totally digest everything. They're very big guidelines. But I think that we have to distinguish between the idea that the principle is generally accepted, that we ought to treat people at lower risk levels than we did before. But that means it's so important to get the risk estimates right. And the concern that was raised by the Harvard professors is that we may be off a little bit, and maybe we need to check those numbers to make sure they apply to people today.
And where do you fall there? I remember when we first reported the guidelines when they were released, we talked about the fact that there were some members of the medical community that had concerns. And then, of course, Dr. Ritker and Dr. Cook came out with their trying of the calculator, saying that it overestimated by up to 150%. Do you share the same concerns as the Harvard doctors or not?
You know, I think there's a little concern in my mind about the calculator. There's two things that they've done. One is that the prior calculators look just at your risk of having a heart attack. This new one looks at heart attacks and strokes. So because there are two things that could happen there, the risk is going to be higher because it could be either one of the two. So that's part of the reason why it's higher than before. The other reason is that we know that the risk of heart disease has been going down over the last 20, 30 years. And so the data that this is based on is a little bit older, and some people think that it's not quite up to date right now. The final thing I'd say is that nobody's going to rush out and take one of these cholesterol drugs on their own. They're going to have to go talk to their doctor. And I think that the patient should have conversations with their doctor about whether they ought to start taking a statin medication. And statins are not a cure-all. I mean, if your blood pressure is too high, you have to take your blood pressure medication. That's an especially important thing for African Americans, where blood pressure is often high and often not controlled well. So it's important to not think that this is a cure-all. It's not the only thing you have to do to prevent heart disease, but it's one of several things.
Of course. And of course, this all, as you just related very accurately, this all comes down to the doctor-patient relationship and what the doctor recommends for that individual patient. So, but in general, in the medical community, do you think doctors at this point will revert to the old guidelines and the conventional wisdom and wait until all of this controversy sort of sorts itself out?
I think that people will, if you're very close to the borderline of 7.5%, people will probably wait a little bit. But if you're much over it, I don't think any revision is going to change it that much. So I think it would be worthwhile if people, especially people who are older and have maybe a few risk factors like high blood pressure already, it would be good for them to get their cholesterol checked and to think about whether they might want to take a statin drug.
I don't mean to be gossipy at all with asking you this question, but there have been some reports that there might be some conflict of interest in this debate, and that Dr. Ritker has his own risk calculator that he might be promoting. What do you make of all of that?
Oh, I wouldn't worry about that too much. Dr. Ritker and I have disagreed on things in the past, but I respect him. He's a very good scientist. I don't think this has anything to do with any conflict of interest on his part. No, I think it's a legitimate scientific dispute about the best way to make the calculation. he has some very good data, and he says that in his data, the numbers are lower than this. And I think it's too bad that a bit of quarrel among experts is playing out in the public, and it should have been settled before this came out.
Yeah, that probably was the key right there. Dr. Mark Hlatky, thank you so much for taking some time with us. We do appreciate it, and welcome home.